So we are doing this video to address some of the concerns that have happened. I just mean me and some other people helping me out. I'm a parent, I'm a citizen, and to address concerns about the Marillac Clinic and to talk about some of the questions that came up and to provide some of the answers to the public so that people have the documentation. And so we're going to go through this video kind of not point by point, but there will be breaks where I'll pause and kind of talk about some documentation that we have to answer one of the questions. It is kind of long, or just kind of, it's kind of confusing, but that's why I recommend, if you go through this, pause it as much as you need, go back, rewind, go back through it, reread the people's words, and then read all these documents that we give you. These are not mine. I didn't make these up. These came from Marillac. They came from the district. I just am kind of putting them together in one video and answering those questions that came up with their own documents that we finally collected after these meetings were over. That way it could become more clear, are kids getting care without parental consent at this clinic, and if they do a clinic at Grand Junction High School, will that be happening there as well? And how does that work?
Do I have it right, though, that students, that there has to be a parental consent for students to use the clinic?
It's part of their registration.
Yeah.
When a parent signs it, is they are consenting.
Okay, so I just want to repeat that for anybody who might be listening. So it is in the registration packet for students when they pick it up for parents to consent to the student accessing the health clinic. So,
Just to clarify, we send those from DocuSign directly to parents.
okay, and they're sent directly from DocuSign to parents. Okay,
So if you don't have that signature, then the student can't access the clinic, is that right? For anything?
For anything, at all.
I'm just asking.
I believe so.
So this is where Doug Levinson asked this question. He says, so if you don't have that signature, then the student can't access the clinic for anything. And the Marillac representative, which we couldn't get his name exactly, he says, I believe so. That was his words. Now as we go through the meeting, it starts to unravel a little bit, and they start to kind of go, wait, well, actually, there's other things that people or kids can consent to. And the next answer is coming from Christy Schmidt. She's the Chief Development Officer for Marillac. And she's talking about how, and even in the Memorandum of Understanding, it makes it pretty clear that if there's an emergency, then the clinic could treat, but they're going to still try to make contact with a parent. But she's just going through that part. Then it's the next answer they give is where it starts.
Or they'll try to get verbal consent, so if there's an urgent issue, they usually, what they've told us, our providers, is they work so closely with the school nurse. Because that's a process.
Sure.
Most of the kids go through the nurse first,
Sure.
and then she directs them or brings them over
Sure.
to the health center. So that they engage with the school nurse to be able to help with getting verbal consent if they don't have it and there's an urgent issue, an injury, something like that. And they'll work with the school nurse to get the verbal consent, try to call the parent,
To-
get them on the phone, talk to them about it.
So to be clear, for a student to access the clinic, there's either verbal or written consent by the parent.
Depending on what the service is, if they say they're coming in for a behavioral health visit, then it follows this.
Depending on what the service is, if a kid is coming in for a behavioral health visit, then it follows this. She's referring to all of the stuff that's legal under Colorado state law. And later in this video, I'm going to read off the memorandum of understanding. Carrie Schultes actually reads the first part off here in a second. But just remember what this lady says. It depends on what the service is.
Right, so the clinic, per my understanding is, I mean, because state law is going to trump any policy or procedure that we would have, because this is law. So if a student doesn't have to have parental permission to access that service, they could go to any clinic, not just the clinic that's in the high school. They could take a bus and go to any clinic and access those services without parental knowledge or consent. That's as the law, as I understand it. Okay.
There might be a registration process that entity uses to register them as a patient.
Okay, so there could be a registration process.
There could be a registration process. This is the Chief Development Officer for Marillac saying there could be a registration process. Well, one day I just was like, well, I wonder if there is one. So I went to the central website and there's a minor consent form on the site for minors to consent to their own care. As long as it's in, however they classify these different categories. So, and we're going to go ahead and post that right now so you can read it, and then it'll be in our comment section on the different posts so that you can have the document yourself, or you can just go to the central website and you can find it there. That's where I found it.
I remember this one was in one of the presentations, services required by PHE and high school based health center. So that was in that other presentation.
It's the same.
So, as you heard Brian, he said, these are the services that are required by CDPHE with a school-based health center. Now, if you read the list, you could go back and just pause it and read the list, but I'll read off a couple of these. Comprehensive health assessments. There is, mental health screenings for depression and anxiety, reproductive health education and services. Now, there's a whole list, so you'll have to go back through that. But a bunch of this list in the state of Colorado is illegal for a minor to consent to. The Colorado Department of Public Health and Environment is requiring a school-based health center to provide these services. These services are, many of them, legal for minors to consent to in the state of Colorado.
Let me ask you, and forgive me if I missed this, getting back, because this is an issue with some folks, on the parent permission aspect of all the users, right? When you have those, say this year, as an example, 436 users. What percentage, or do we have the cumulative, when you had that one, Brian, that went from 2020 to now? What percentage of users use services that have not had parent permission? Do you have something like that? You see what I'm getting at?
That's a good question. And if you're relating back to reproductive.
Well, no, I'm just as a whole, well, whatever requires, there are some things that don't require parent permission. There's some things there you said do, so that's off the table, we know they do. But the ones, out of the whole picture of users, how many, what percentage makes up they didn't have parent permission? You know,
Majority are going to be, any of those are going to be behavioral health. So if you're asking for a hard number, we don't have.
She's the chief executive officer. She's the CEO of Marillac. And she said, if you're asking for hard numbers, we don't have that, but we can certainly get that. We're going to present the hard numbers that they got back later in this video.
Okay, only because it answers a question that we get inundated with, and like the 1%, that's, I don't know,
Right, so basically,
that's-
anything on the state, anything on that chart that a child can see, someone without parent permission, we just need those broken out by what services the clinic is providing and what percentage of that falls under that category. I'm sorry.
We can tell you on the medical side, it's 99%.
So that's the other representative from Marillac, again saying, but he clarifies more, on the medical side, 99% have had parental permission. And then, right now is about when the memorandum of understanding is about to be brought up for the first time.
Okay.
Okay,
That-
on the medical side, 99% have permission.
No health services shall be provided to the child under 18 by the medical sponsor or subcontracting organization without prior written consent of medical services.
It's the BH1 that's why we're hesitant, because the BH1 has a lot more stipulations around
Okay.
consent. That's where we get.
It's the BH1 is what he said. The BH1. That's behavioral health. And it has a lot more stipulations around parental consent. That's why we're hesitant.
Only to get context of, as that comes up, so we can answer with facts and not just what we think or what we hear somebody says it is. You just see what I'm saying? So-
But also, we can rest assured that no health services are being provided without parental consent. No medical service is being, unless, except in the case of an emergency, a life-threatening emergency.
I need to make every attempt to contact the guardian, the parent.
Okay,
If we can't, we just take care of the emergency.
great point.
But just to clarify what you requested, we're looking for total number of users, numbers who are getting services without minor consent, and what are the reasons that they are not, they had a visit under minor consent. I'm assuming that's the data you wanted.
So once again, the CEO is clarifying that she can get the numbers for those that receive minor consent.
I think it's just to have a better understanding of this, how widespread is it? I think there's a notion among some that it's just, and I could go in and get anything done, and, well, no, but that's what people believe, right? And I want to dispel, if it is, can be dispelled, what actually is happening, so we have facts over perception or what people think. Because I don't know what that.
All right, so that's the end of the first meeting. And then now we're going to cut to the board coffee meeting that was about a week and a half, 2 weeks later, after the first meeting. And at that meeting, there's a gentleman there who's asking questions about parental consent and all of this. So we're going to start with him just starting to ask those questions.
Are you aware that the Marillac Clinic has a consent form on the Central High School Wellness Center for minors to be able to consent to receive care without their parents' or legal guardians' approval? That's a question, actually.
I don't know what the law is about what's required and not required, but I know that they follow the law.
Oh, okay. Are you aware that the Marillac Clinic has a minor consent form on the Central High School Wellness Center website for minors to be able to consent to receive care without their parents' or legal guardians' approval?
To the extent that it complies with the law, I think we're familiar with that
Okay.
to a certain extent.
On the consent care form, it says, I am seeking minor consent services. I will tell my healthcare provider what services I am seeking. In the memorandum of understanding between Mesa County, Valley School District 51 and Marillac Clinic, it states that no health services shall be provided to a child under the age of 18 years by the medical sponsor or subcontracting organization without prior written consent of his or her parental or legal guardian. However, in life or health-threatening emergencies, employees of the medical sponsor may provide life support services without written or oral approval. parental consent.
So that's not saying, what that initial consent is saying is, it's not saying that the student can direct medical services. They're saying that they can consent, they're saying that this is what I would like to consent to, and if that's in compliance with the law, then they can service them. That is not saying that the student gets to dictate that medical services are provided to them without parental consent.
So as far as that answer goes, I mean, she's partially right? Like, it is that the document is a way for a minor to consent to their own care as far as what's legal under the law, which is kind of the whole point that I've been getting at over and over. And the point that was made during the meeting, the first meeting. And, if we just take that to the next step, she's saying that they can't direct the care to be given to go ahead and get consent without their parents. Well, yes, they can. Like, legally, under Colorado state law, anything that is legal for minors to consent to, they can request that their parents aren't involved. That's that simple. And so, we're gonna post the laws, but you can look them up. Like, it's just that easy. Colorado minor consent laws. And on top of that, even if, we're admitting somehow now that sheet, which is a minor consent form, allows a minor to consent to some things that they're somewhat able to do, that you're admitting that there are kids or minors getting care inside the clinic without parental consent, which goes against the memorandum that she had read off over and over in that last meeting. Okay, but I don't, all of that didn't get talked about right there.
Okay. Are you aware how many kids under the age of 18 have received care without parental consent at the Marillac Clinic at Central High
Yeah, I
School?
don't remember it, but they presented it to us at the last meeting.
Yeah, my understanding is it's less, of all the students that participate in avail themselves of the services, it's less than 1%.
But there's less than 1%. Okay.
That's my understanding.
But
But we can check.
I don't remember,
Yeah.
we can check. It was in the last meeting, it's publicly available information.
Okay, so the question was, are you aware of how many kids under 18 have received care without parental consent at the Marillac Clinic at Central High School? And you can see by their first answer, Doug said he believes it's around 1%, and Carrie said that it was in the last meeting. So now we're going to play the clip from the last meeting to see what the CEO of Marillac said about that.
I'm just as a whole, well, whatever requires, there are some things that don't require parent permission. There's some things there you said do, so that's off the table, we know they do. But the ones, out of the whole picture of users, how many, what percentage makes up they didn't have parent permission?
Majority are gonna be, any of those are gonna be behavioral health. So if you're asking for a hard number, we don't have that, but we.
So, as you can see, what the CEO said was that they don't have that data, they didn't have it at that time to present to the board. So, they said they would collect it and get it to them. Now, this board coffee was about 2 weeks later, after this meeting, the first meeting. And the clinic, or the Marillac, did get back to the board. I don't know if Doug and Carrie didn't receive this or they didn't ask for it, I'm not sure. But they got back to the board, and percentage of students that received care at the clinic without parental consent was actually 18.43% of the total visits. And we're going to display this is the chart that they sent, that Marillac sent back to the board, just so people know this is straight from them, not from me, or I didn't make this up or something. But I don't know if Carrie and Doug just didn't get this or they didn't ask for it. I have no idea. But what I can say is a couple weeks after the first meeting, they just don't know. And so also, just kind of important, we'll put this out here too, for a behavioral health visit for the school year, 51% of the behavioral health visits are without parental consent. The unduplicated patients, it is actually 62.4% of the unduplicated behavioral health patients are without parental consent. So that means, I guess, like the first time somebody goes, basically, 62 for behavioral health, right? 62.4% were without parental permission. So, I mean, reading the memorandum, I mean, I don't know, like, you guys can read it for yourself. We're going to post that also. I will just read off the two statements on the memorandum. This is in the Memorandum of Understanding between the district and Marillac Clinic. This was written, I believe, right when the clinic came in. So Lisa Sharp is the person that signed this. She was the Director of Contracts and Purchasing for the district. And so the first part says, no, this is on the second page, under the, what the clinic's responsibilities under this memorandum. No health services shall be provided, and it's the same thing that Carrie Schultes read off multiple times in that first meeting. No health services shall be provided to a child under the age of 18 years old by the medical sponsor or subcontracting organization without the prior written consent of his or her parent or legal guardian. However, in a life or health-threatening emergency, employees of the medical sponsor may provide life support services without written or oral parent or guardian consent. So that's simply saying that if a kid's choking, they're going to go ahead and help the kid, which that's fine, right? Nobody's going to have a problem with that. But the question is, are we just saying that the behavioral health services that the clinic's providing without parental consent doesn't count as a health service? Because they're doing it. They're giving it without parental consent, which they can prescribe medication. There's a lot of things they can legally do. If you just read the laws in Colorado, you can see what can legally happen. When you go down in this memorandum, and this is why like reading the fine print matters a lot. Here we go. Colorado, this is number 9. On page number 4, Colorado law and regulations allow minors to consent for and receive the following confidential health services: alcohol, drug abuse treatment, outpatient mental health treatment, contraceptives, pregnancy care, and STD, HIV diagnosis and testing. So Colorado law and regulations allow minors to consent for these things. Okay. Now, why would you put that on your memorandum of understanding that says no health services? Like, if you go back to the first question, no health services. When you read this one, it says Colorado law and regulations allow minors to consent for and receive the following confidential health services. So we can't, no children are going to get, no minors are going to get any health services without prior written parental consent. Also, Colorado law allows minors to consent to the following health services. Same word, health services, in the same memorandum of understanding. And at the same time, when the clinic launched, they immediately had to put out the minor consent form that minors can fill out to consent to their health services. So they instantly, this either the memorandum is completely just contradictory it uses the same word, health services, right? And they've been giving health services to students without parental permission of all these kinds. Actually, it's not just they can do contraceptives, pregnancy care, right? Which they said was less than 1%. So listen, I'm not saying, I don't know all of the percentages of those different things, but I'm saying that is legal, and they've done some of it without parental consent. So the first statement that no health services will be given without prior written consent is not even something they legally can follow if a patient requests it and is a minor and it's legal under the law. They cannot refuse that service. They would have to, refer it out or do it themselves or something. And so they wrote a memorandum of understanding that they could never legally follow. It's pretty clear, when you read that. And they haven't followed it, right? The 18.3%. Anyways, haven't had parental permission of the total visits to the medical center. And that's kind of the issue, right? Like, this is where, when parents start asking questions, we're like, is any kid getting services without parental permission? And people would basically gaslight us and say, no, it's not happening. There's none. It doesn't exist. District 51 requires consent. The truth is, District 51, once the clinic is inside the building, District 51, even if they say they're requiring consent, they can't legally do that, because the Colorado state law says that a kid or a minor can get these types of care. So the problem is this memorandum and what can legally happen, and the fact that parents and the community was not aware that this is happening, even though the memorandum says that. The problem is it's not transparent. The problem is it was so confusing that one of our board members that clearly supports the clinic repeated it over and over in the meeting. No health services will be given, over and over. And then, like we saw at the next meeting a couple weeks later, they didn't follow up on it and even ask, what it was. They didn't get the follow-up answer. I'm just pointing it out, and I'm just providing the documents to the public so people can see. This would be what you would want to take to the school board, the documents, and that's where your concerns can be, actually addressed that way. And, they're making a big decision. Are they going to put the clinic in the school? Or are they going to have it somewhere else in town? Or do some type of other halfway, way of helping some of the students that need help? They're making this big decision. It's going to cost a lot of money if they do it. The district provides the building, the space, and the rent, or no rent. They don't get paid rent, and they provide the utilities and janitorial services. They don't get any type of money back from the clinic, but they are required in the memorandum to promote the clinic. So that's, they're promoting the clinic inside the school that is giving over 18% of the care to minors without parental consent. The district is promoting it even. So it's not just like it's in the building. They're literally required to promote it, and they've been promoting it for 3 years. We're going to have more documents in the comments on the Facebook post. You'll see the documents down in there. You can read them for yourself. You can share them with people. You can let people know one way or the other. But I just thought that this was really important just to kind of clear it up, because it's so confusing. And even the board members that came out of the meeting were still completely confused because of the way the memorandum was written. And, as a parent, I'm I care about my kids' health so much that I will sit here for hours reading through documents, watching these videos, trying to piece together what is actually going on, no matter how confusing it is, no matter how much legal language it is, because I'm a parent. Like, that's what we do for our kids. So I appreciate everybody watching this, and I just want to say that this is a big decision and something that our community should really all be involved in one way or the other.